I'm Rachel Cascone, and I'm presenting Module 4. In Module 4, we're going to review some of the common challenges of breastfeeding and some of the common concerns. The first set of challenges new parents face revolve around the baby's activity. As we learned in Part 2, a sleepy baby is normal and expected in the first 24 hours, but we still want to encourage the baby to breastfeed and get at least one good feeding in the first 24 hours of life. There are a few things we can do to help a baby that is sleepy have better feedings. First, try to wake the baby up by burping or changing the diaper. Once baby's awake, try to latch. Next, breastfeeding in skin to skin instead of swaddled in a blanket can be very helpful in keeping the baby awake. Another technique to try is massaging and compressing your breast during the feeding to help milk flow more quickly and keep the baby interested in the feeding. Finally, something as simple as talking to your baby, rubbing their feet or their back can help a sleepy baby feed well. Unlike the sleepy baby, the fussy baby poses a different set of challenges. As you've already learned, crying is a late sign of hunger, so responding to feeding cues quickly will help baby be more content. It's important to know that crying does not always mean the baby needs formula. Remember, babies are used to being held in a warm, dark environment where sounds are muffled. As a result, babies can be easily overstimulated by being passed around from person to person, by the bright lights around them, by the new noises they hear. If your baby is acting fussy, you can either place them in skin to calm and soothe them, or you can practice getting a good swaddle to help the baby feel secure. A very simple group of activities called swaddle, sway, and shush can be helpful to soothe a fussy baby. First, get the baby in a good swaddle, then hold them close to you, gently rocking back and forth while patting their back and making shushing noises. This activity mimics the environment they're used to. Once the baby is calm, that's the perfect time to try to breastfeed. Trying to breastfeed a crying, fussy baby can be very stressful for everyone. Instead, help the baby get calm, then work together for feeding. The third most commonly challenging newborn behavior is something called cluster feeding. Cluster feeding is when newborns have periods of feeding that aren't spaced apart. There's no break between the feedings. It can happen anytime, but most commonly occurs at night. This is also the most common time for new parents to doubt themselves. When babies are cluster feeding, the behavior is mistaken for low supply, which isn't true. In fact, cluster feeding is a normal, healthy behavior. And by allowing the baby to breastfeed for as long as they want and as often as they want, it helps them get enough to eat and help you make a robust supply of milk. It's important to know that this behavior is temporary. It won't last forever. Cluster feeding happens in the first few days of life, and then again at different periods when the baby has a growth spurt. The next group of challenges and concerns are centered around mother's breasts and nipples. Sore nipples are a major concern for many women. The most common reason that women get sore nipples is from allowing the baby to stay on the breast with a shallow latch. There's a common myth that breastfeeding is supposed to hurt and then get better after a few weeks. But in truth, sore nipples are usually caused by poor positioning and latching and can be easily prevented. A good latch prevents nipple pain and soreness, and it helps baby have a good feeding. When the latch is shallow and painful, the baby is letting you know they can't get any milk from the breast. They want you to fix it for them. It's true when you're first learning to latch, temporary tenderness for up to a minute is normal, but pain is not. If the latch is painful, take the baby off the breast, reposition, and relatch. If you see your nipple looks flattened or creased or misshapen in some way, that is a sign the latch was not deep. A deep, comfortable latch does not distort your nipple shape. Engorgement refers to the breasts gradually filling with larger volumes of milk. There is normal breast fullness where the milk still flows and the breasts feel better after breastfeeding or breast pumping. On the other hand, when problematic engorgement happens, the breasts feel tight and look shiny. The baby has trouble latching, or you can't get the milk out with a breast pump. A few simple practices can help prevent problematic engorgement. First, make sure the baby's latched well and can easily move milk out of your breast. Second, allow the baby to stay on the first breast until they are finished and it feels well drained before offering the second side. Third, alternate the breast that's offered first at each feeding. Finally, breastfeeding frequently, especially at night, prevents problematic engorgement. But it could still occur, even when you try all these preventive measures. If it does, that's the right time to connect with a support group or community lactation consultant to help you. Plug ducts are firm, tender lumps where the milk is unable to be released. Often, they're more noticeable before feeding and get smaller after feeding. Using a warm compress before feeding and then massaging and compressing the breast in the area of fullness can help release the milk. Sometimes changing your breastfeeding position can help different areas of the breast drain better. Make sure your bras and tank tops fit properly and don't press too firmly on any areas of the breast so all areas can drain well. Mastitis is an infection in your breast. When a woman has mastitis, she normally experiences a fever. One area of her breast becomes very hard, hot, and painful, and it happens quickly. She has body aches and chills. It feels like the flu. She's really sick. Women with mastitis need antibiotics, so they have to call their obstetrician if they have any of these symptoms. To manage her breasts, she should maintain frequent breastfeeding or breast pumping. Use warm compresses on the painful area, massage and compress the breast during feeding or pumping to help the milk flow. It is safe to breastfeed with mastitis and most of the common antibiotics used to treat it. When you're breastfeeding, there are some do's and don'ts with your diet and medications. Do eat a variety of protein, carbs, and fats. Do eat foods high in fiber. Do drink water to thirst and have healthy snacks to keep your energy levels up. Don't use saccharin. Don't eat fish high in mercury. Don't have more than one alcoholic drink. Don't smoke. And don't pump and dump. Most medications are safe. Ask for help if you have questions about medications. The first days and weeks at home will be exciting, but you'll be tired. Here are some tips to take the best care of yourself and your new family. Limit visitors. They're happy for you, but you might feel obligated to be a good hostess. Your partner can help you set limits on the number of visitors each day and how long each visitor stays. Ask for help. Some visitors will be those special people that are there to help. Don't hesitate to ask for help when you need it. Having someone drop off a tray of food for dinner, someone to throw laundry in the dryer, someone to hold the baby while you shower, all new families will benefit from that type of help. Nap often. This one can't be overstated enough. Your newborn will not be sleeping through the night for several weeks. Taking naps can really make the difference in your ability to cope with the stress of new parenthood and enjoy the time together when you're awake. Focus on your new family. There will be a lot of changes and adjustments for everyone. Be patient with each other and support one another. It's important to know when breastfeeding isn't going well and when to call your baby's pediatrician or your obstetrician. Call the pediatrician if the baby does not breastfeed frequently enough, at least 8 to 12 times every day. If the baby doesn't make enough wet and dirty diapers for the day, or if the baby still has black stools on day 4. Call the obstetrician for mom if she has a fever or a hot, painful lump in the breast. Here are some of the most frequently asked questions related to the topics in this module. Should I pump and dump? Reach out to the lactation consultants at the hospital for help. They can provide you with good information to bring to your pediatrician to discuss breastfeeding. Pump and hold your milk until you get good information. Help, my nipples hurt. The most common cause of persistent nipple pain is poor position and latch technique. Take baby off the breast, improve your position, and try again. Practice makes perfect. What's the best nipple cream? Nipple creams or butters are not recommended because they change the smell and taste the baby's looking for. Using your own milk is preferred. You're encouraged to come back and watch these modules as often as you need, especially once the baby arrives, to help reinforce what you've learned.